Hello everyone, my name is Pinky. I'm the Pharmacist prescriber. Today I'm going to discuss about high blood pressure in patients. So, in order to monitor blood pressure, you need to make sure that the appropriate cuff size is used, okay? Appropriate cuff size, okay? This cuff basically goes around the arm, so it has to be appropriate. Now, there are two ways to monitor the blood pressure basically in general, okay? One of them is by using the electronic machine. Another one is to take the reading manually using a stethoscope and this cuff. Now, if the blood pressure reading is more than 140/90, then what do you need to do? If it is more than 140/90, then you need to make sure a second reading is taken. And if that second reading is different from the first reading, then a third reading needs to be taken. And you need to consider the last two readings. Now, obviously, if you're using this electronic machine, this will give you the pulse. And if the pulse is irregular, if it is not regular, then obviously this electronic machine might not give you the right blood pressure reading. In that case, what you need to do is you need to use, like obviously general population, they can't use the stethoscope and the cuff. You need to book an appointment with one of your doctors, pharmacists, nurse, other healthcare professionals to take your blood pressure manually. Now, this is very, very important in order to identify whether the readings are right or not. In order to diagnose high blood pressure, usually what happens is that a 24-hour monitoring machine is attached to a belt which goes around the waist of the patient, and the cuff is attached to connected to the arm. And that 24-hour reading helps to diagnose whether the patient is suffering from high blood pressure or not. And this is what it is. And clinic readings, basically they are used for to assess the response to treatments. And it is a good idea as well to make sure whether the patient is doing well, and if there is any problem. It's just for monitoring purpose. So while running high blood pressure like hypertension clinic, what is usually suggested to patient is that monitor your blood pressure at least 3 times a day ideally, but if 3 times a day is not convenient for you, go for once daily or twice daily. Monitor your blood pressure. Now, as you can see in this electronic machine, this is the systolic. The systolic is when the heart contracts, diastolic when the heart relaxes, and pulse is the rate of the heart. Monitor the blood pressure reading, write them in a piece of paper along with your pulse, and after 7 days do the average. And the overall picture of the reading and the average will give an idea whether to adjust the dose if the patient is already on a blood pressure medication, or to initiate a blood pressure medication. Now, it's very important to follow the steps. Say for example, like when you monitor your blood pressure at home, ideally go for a wee first, like urinate, empty your bladder for half an hour, no eating, no drinking, no exercise. Sit down in a chair calmly for 5 minutes and then take your blood pressure reading and then record it. Ideally in general practice, it is not always possible to offer the patient the ambulatory blood pressure monitoring recording system. So in that case, what we usually do, we follow these following steps. So what lifestyle advice I'm going to give the patient? Reduce your salt intake, caffeine intake, like tea, coffee, go for decaf. Reduce your tea and coffee intake. Half an hour activities every day. Healthy diet and lifestyle. Stop smoking, reduce your alcohol intake. If your blood pressure is less than 140/90, then recheck your blood pressure every 5 years. If it is close to 140/90, then obviously close monitoring is needed. So most important things which needs to be remembered is the figures, right? If the systolic blood pressure is 140 to 179, and if the diastolic blood pressure is 90 to 119, then 7 days blood pressure monitoring at home is required. Your clinicians will request for certain blood tests. Okay, the blood tests are as follows, such as albumin creatinine ratio ACR test, HbA1c, which is the measurement of the sugar level in the body in the past 3 months, kidney function test, the lipid profile, and an ECG is also required. Okay, now if the blood pressure reading is more than 180/120, then you need to look for certain symptoms. What are the symptoms? The symptoms are like, your eyes are gonna get affected, there can be, bleeding in your eyes, and the blood pressure will fluctuate. It will be low blood pressure and high blood pressure. In between it will fluctuate, and if it fluctuates, it's a risk factor. And headaches, palpitations, you're gonna look pale, clammy, excessive sweating, and life-threatening symptoms are all of a sudden. If there is new confusion, chest pain, or there can be kidney injury, there can be heart failure. So it's always important, like your clinician will look for the any target organ damage. If there is damage, then obviously you need to be treated immediately. If there is no damage, then again the blood pressure needs to be monitored at home for 7 days. Now I'm going to discuss about what to do if the patient is in stage 1 hypertension. So in stage 1 hypertension, if the systolic blood pressure is between 135 to 149 and diastolic blood pressure is 85 to 94, then what you're going to do? So you have to take into consideration the patient's age, the QRISK assessment, as well as if the patient is suffering from any other diseases. Now, if the patient is less than 80 years old with kidney disease, cardiovascular like heart disease, target organ damage, diabetes, then lifestyle and medications. Recommend this to patients. Now, if the patient is less than 80 years old without any heart disease, kidney disease, target organ damage, or diabetes, then there are 2 things. Okay, one of them is if the QRISK assessment is more than 10%, then you need to consider drugs as well as lifestyle. Okay, now if the patient is more than 60 years old and the QRISK assessment is less than 10%, then lifestyle alone and review annually. If the patient is less than 60 years old and the QRISK assessment is less than 10%, consider drugs. You have to understand here that in younger patients, say for example less than 40 years old, the QRISK assessment may not give you the right result. In that case, you need to refer the patient to a cardiologist. Okay, now another thing is if the patient is more than 80 years old and the blood pressure is more than 150/90, then you consider drugs as well as lifestyle. So this is all about how to manage stage 1 hypertension. Now I'm going to discuss about stage 2 hypertension. So in stage 2 hypertension, if the blood pressure is like more than 150/95, it's stage 2 hypertension, and we always recommend medications for patients. Now, regarding medications, I'm going to give a chart at the end of this video. Obviously the general population, they won't be able to initiate the medication. It has to be a healthcare professional or a clinician who is going to start or initiate blood pressure medication. Another important thing which one needs to understand in hypertension is called like white coat hypertension. If the difference, okay, in systolic blood pressure is more than 20, and in diastolic pressure, if the difference is more than 10, then you have to think it can be white coat hypertension. And there's another thing called masked hypertension, where the blood pressure at home is more than the clinic blood pressure reading. Now these are all about high blood pressure, how you can monitor your blood pressure at home, when to seek help. I discussed about the red flags, the life-threatening symptoms, and look after yourself. Always, like, read the patient information leaflet before you take any medication. Always consult your healthcare professionals before you take any medications, and look after yourself. That's the most important thing. Lifestyle advice is always the first line. Okay, thanks for watching. Do like, share and subscribe my channel. Follow me on Twitter, Instagram, Facebook page. Thanks a lot. Bye for now. Take care.